Our medical physics residents interact with faculty, residents, and staff within the department and contribute in many positive ways. It's a busy but productive and highly constructive residency.
Our residency has graduated 18 residents, most of whom go on to positions in academia. However, we've had residents go on to clinical as well as industry positions.
Here at Duke, it's very helpful to follow the different physicists and follow their respective tasks, as everyone is specialized with different treatment sites. We have SRS, SBRT, lung, breast, and prostate treatment teams that really helps the residents learn a lot by following these respective teams.
We train residents in multiple dimensions: professionalism, the technical skills, interpersonal skills, as well as the visionary skills to be a future leader in the field. The residents will have a large body of faculty to be trained. We have overall about 20 faculties who can work with residents.
Residents are part of our clinical team from day one. For QA, new residents will follow physicists and senior residents. After a few days of training, they can perform QA independently. For treatment planning, again, they first follow planners and shadow. And after they start learning, they'll actually do treatment planning for actual patient cases. Treatment planning rotation is not just to learn the treatment planning technique. And I encourage them to go to CT simulation to watch cases they're going to plan, and also go to the treatment machine to watch verification sim and treatment delivery for the cases they have planned.
The residence training curriculum at Duke is comprehensive and well-structured, and it gives you good exposure to all regular clinical tasks and the special procedures. I have found the treatment planning rotation to be the best to start during the residence training. In the treatment planning, we are not just creating a real plan for the patient, but also we are able to follow the patient from their CT sim all the way to their final treatment on the LINAC. By going throughout this whole process, the residents are given the opportunity to know all the therapists, dosimetrists, physicians, and the physicists in the clinic.
I think the layout for the program and specifically for each rotation is well organized. It really prepares you well for everyday clinical tasks and also prepare you for the board exam. In this way, as the training is laid out, I believe each individual graduating from our residency program is well prepared for their future career, both clinically and also academically.
Here at Duke, we treat a lot of brain metastases, and there are many experts in the field, leaders in the nation. It's very encouraging to learn from senior physicists and also from expert radiation oncologists. And it's very cool to interact with them because at some point of the day, everybody would meet at the dosimetry room where we can talk and we can ask questions more in details about the disease. That's definitely one unique thing that I enjoy a lot here at Duke.
So really seeing residents become independent physicists while they're here is due to our program's unique nature and really throwing the resident into the residency program, being directly engaged in our clinical work. So there are not a lot of training wheels. We are there to help you and it's very structured, but the idea is that you're not a student anymore, you're a trainee, and I really see the progress within the first couple of months. And towards the end of the residency, the resident is a fully independent physicist, and I can trust them to go anywhere and do excellent work.
All our clinical physicists actually do academic research as well. So we are big enough to have very diverse research activities among all the physicists, but we are also have very close relationships with our own medical physics program. Our residents will see both sides of our physics activity, that's clinical operation and academic scholarly activities.
In addition to the clinical training, we offer great opportunity for our residents to conduct a research project, maybe clinical oriented, such as clinical protocol development, or projects quite scientific, such as methodology development. We hope we could use our expertise, expand our residents' expertise in both imaging and the therapy field.
You will have the opportunity to work with the faculty members with some clinical-oriented projects, which further enhance your experience in that rotation services, as well as prepare you, to find the interest that you really have to further dive into in your future careers.
One of the things that people always ask is, are we able to, as physics residents, able to participate in research projects? And I would say you would participate closely with radiation oncologists, clinicians, with radiobiologists, as well as other physicists, in carrying out really some cutting-edge research. You're an integral member of both the research and the clinical teams here as a physics resident at Duke.
We have a comprehensive medical imaging system covering from GE CT, Philips CT scanner, Siemens PET-CT, ultrasound, Burnlab mobile CT, and Siemens MI scanners. To ensure high quality of patient care, all these imaging systems are managed by our medical imaging physics team and a comprehensive QA program.
Just a little bit about the equipment that we have here. We have a lot of different types of QA equipment for our Linacs, both for standard IMRT and SRS, SBRT. As we get that new equipment, we've involved our residents in commissioning it. There's also opportunities for research projects, kind of clinical research projects, and bringing those things to the clinic and how to best implement them. That also includes some of our new planning systems or independent dose calculation systems. And we have a lot of radiosurgery-based research in that area especially. For example, this is our SRS map check that we've been doing some research with in how we best implement that into our SRS protocol.
We perform total body irradiation as a conditioning regimen for patients that undergo transplant here at Duke. Duke is one of the larger centers in the world, so we see a lot of patients. There's a lot of opportunity for our residents to get involved. The other section is what we call total skin irradiation. We use a different mean of delivering radiation, this time using electrons, and a completely different prescription for patients usually that present with mycosis fungoides.
For special procedures, total body irradiation and total skin irradiations, and Duke is special because we have a large patient populations, so each resident will perform at least 6 months rotation.
Our residents get to do all the behind the kind of screen work that a physicist will do related to these large field dosimetry techniques, but also uniquely they get to interact with patients, with physicians.
These special procedures are not performed regularly in other facilities, and we're lucky at Duke to have this many special procedures.
One of the really unique things I think about the residency program here at Duke is how quickly the residents are integrated into the brachy program when they start their brachy rotation. I'd say within a couple weeks the residents are pretty independent on the daily QA and the weekly QA for the afterloader. And I'd say within a month and a half with treatment planning, the residents are pretty independent and able to plan most of our cases, even our complex cases. The other thing that's really unique about our institution, I think, is we actually have 2 afterloaders. So that means we have twice as many opportunities for the residents to do source exchanges, which is only happens quarterly. So the more opportunities they have to do that, the better. They're able to actually observe one, participate in one, and then even sort of take the lead on a couple of source exchanges.
At Duke, my principal area of interest are tumors of the brain, base of skull, and spinal cord. And in that area, I work extraordinarily closely with physics on treatment of these tumors, particularly using a technique called stereotactic radiosurgery. In this technique, we're delivering extraordinarily high dose of radiation to often very small and irregularly shaped areas in the brain base of skull and the spine over a few fractions.
SIS and SBRT program here is very busy. We have many cases. On a typical day, we'll probably have 10, 15 cases on treat. So residents will have enough cases to observe and to practice. We will start with a simple case first with the resident. Then we'll move on to different type of cases, such as multiple lesion, single ISO, with the FMAT planning. And for SBRT, we go by each site.
We have a lot of experience here at Duke with medical physics residents. The medical physics resident works with the dosimetrist to contour all the normal tissue structures and plan the patient's treatment as was prescribed by the physician, and then also to prepare the patient's chart to get it ready for treatment delivery.
So what I really enjoy about Durham is that it's so compact. You can get anywhere in a relatively short amount of time. Living costs are quite low, and yet it is very diverse, culturally active, with all the universities in the Triangle area, and excellent food.
There's always new exciting places to go out to eat. We've got DPAC if you're into the theater, the Hurricanes if you like hockey. We've got the Durham Bowls for baseball, all kinds of, and of course our college sports are also amazing with Duke and UNC here. So there's lots to do around the city. We're very close to the beach. You can drive there for the weekend very easily. The mountains in the other direction. It's not too hot, hardly ever snows. So it's just been a really great place to live, to work. We've really enjoyed our time here.
At the end of my graduate school, I do have a lot of opportunity to go outside to visit different programs across the country, to explore different opportunities and to find the interest that I have, to decide my future career. I feel like I still find Duke my best choice.
I actually graduated from the residency program a long time ago. It was the second or third generation of residents that graduated. I think we've got a pretty good balance of clinical load and also a little bit of freedom to pursue different research areas. There's opportunities to work with all the different faculty in each of those rotations, that I think that's really good.
There's a lot of research opportunities. On top of that, of course, it's a very high quality residency training. And also I was drawn to the people. I feel like the people here are very friendly and happy and knowledgeable.
I had the pleasure of being a graduate student here at Duke, where I received my master's. I chose to stay in the medical physics residency, namely for the faculty. Duke manages to pair expert faculty that are both experts in their field and personable with the wide clinical experiences that helps us become more well-rounded physicists. We follow all these QAs. Okay, wait, let me.
Just don't. Actually, that's not true, so I will just start again.
And yeah.
I'm sorry, can I start over?
Go ahead.
So, yep, that's it.